Hello everyone and welcome to another installment of our Aruka STA Health series on cardiovascular diseases. My name is Nikisha Millett and today I will be discussing cardiovascular diseases and the importance of medical compliance. So just for a quick recap, cardiovascular diseases are a group of diseases of the heart and blood vessels. This diagram outlines some of the more common cardiovascular diseases encountered in clinical practice. Coronary artery disease is a disease of the blood vessels supplying the heart muscle, in which there is an abnormal buildup of plaque, which can compromise the blood flow to the heart muscle, leading to conditions such as a heart attack. Valvular heart disease is a disease in which any valve in the heart is damaged or diseased. There are 4 valves in the heart, and when one or more is damaged, being either stenosed or regurgitant, this is called valvular heart disease. An aneurysm is an abnormal dilation or bulge in a blood vessel, which is caused by a weakness in the blood vessel wall. An arrhythmia is an abnormal or irregular heartbeat in which can cause the heart to pump either too quickly or too slowly. A cardiomyopathy is a general term for diseases of the heart muscle where the walls of the heart chambers become stretched, thickened, or too stiff, and this affects how the heart pumps blood around the body. Pericarditis is inflammation of the pericardium, which is a thin sac that surrounds the heart. And heart failure basically means that the heart is not able to pump blood around the body properly, and it's usually because the heart is too weak or too stiff. So, why are cardiovascular diseases so important? Well, according to the World Health Organization, cardiovascular diseases are the leading cause of death globally. An estimated 17.9 million people died from cardiovascular diseases in 2019, which represented 32% of all global deaths. Of these deaths, 85% were due to heart attack and stroke. Out of the 17 million premature deaths, which are deaths that occur under the age of 70, due to non-communicable diseases in 2019, 38% were caused by cardiovascular diseases. Also, in our very island of Trinidad and Tobago, heart disease is the leading cause of death, and it is the leading cause of premature death in men and women. So when we put all of this into perspective, we understand that the burden of cardiovascular disease is very great on our health system. Additionally, many cases of cardiovascular disease can be prevented with lifestyle changes and early intervention in at-risk persons, and many persons can avoid worsening of their condition if they are compliant with medical therapy and follow-up. So as I would have mentioned before, there are some persons that are at an increased risk of developing cardiovascular illnesses. And the risk factors for cardiovascular illnesses can be divided into non-modifiable, which are risk factors that cannot be changed, and modifiable risk factors, which are risk factors that can be changed. So with regards to our non-modifiable risk factors, some of these include race and ethnicity. Persons who are of a non-Caucasian background are at an increased risk of developing cardiovascular illnesses. Age, persons who are older are at an increased risk of developing certain types of cardiovascular illnesses as well. Gender, males are at an increased risk of developing cardiovascular illnesses, and this is interesting because Females have a hormone called estrogen, which is actually cardioprotective, meaning that it protects against certain types of cardiovascular illnesses up to the age of menopause, after which the risk for females is similar to that for males. Genetic factors, certain cardiovascular diseases such as cardiomyopathy, certain types of cardiomyopathy, for example, can have a genetic component to them. Modifiable risk factors, are those risk factors, as I mentioned, that can be changed. So smoking, which seems to be a risk factor for most illnesses, it puts an individual at an increased risk of developing cardiovascular illnesses. Diabetes mellitus, physical inactivity, obesity, high cholesterol, and high blood pressure also put individuals at an increased risk of developing cardiovascular illnesses. So why then is screening important, especially for these persons? Well, advanced heart disease may exist before the onset of clinical symptoms. There are many persons that may be completely asymptomatic that actually have underlying cardiovascular illnesses, and so it's important that they be screened for such diseases. Additionally, providing appropriate intervention such as medical therapy in the early stages of disease may improve the disease's long-term outcome. Clinical assessment for an individual's risk for cardiovascular disease would consist of things such as a comprehensive history, physical examination, and specific things that would be done on physical examination include a weight and height to calculate one's body mass index, which can place one into either an underweight category, normal weight, overweight, and different types of obesity. And as we know, obesity is a risk factor for developing cardiovascular diseases. Examination of the cardiovascular system, because that examination may show things that can indicate an underlying cardiovascular illness. Examination for features of secondary hypertension, because as we know, high blood pressure puts an individual at an increased risk of developing cardiovascular illness. Examination of the lungs for congestion, because this can actually be seen in persons who have heart failure. Examination of the eyes to detect features of hypertensive disease, and also measuring one's blood pressure is very important. Screening tests for cardiovascular diseases include the blood pressure, which should be done at least once per year once the blood pressure has been normal the year before. Fasting, lipid profile or cholesterol, and this should be done every 4 to 6 years in normal risk adults. In persons who are more at risk, they would require more frequent screening. And a blood glucose test for normal risk adults should be done every 3 years. Now, if on screening an illness is detected, what's next? So that patient obviously would be initially treated for any acute injury and prescribe medication to prevent worsening of their condition. So for example, if you go to have screening for cardiovascular illnesses and high blood pressure is detected, initially your physician may suggest lifestyle changes such as lowering your salt intake, to adopt more physical exercise into your lifestyle, etc. And if that does not help to lower blood pressure, then medication would be prescribed to lower blood pressure as well. Now, once medication is prescribed, we do know that certain persons have several reasons for not complying with medication, some of which include fear. So people may generally be afraid of the medication that they're taking. They may be afraid of the side effects, especially if they have never had a need for medication before the cost of medication, which may not necessarily be a big factor in Trinidad because of our CDAP program, but certain persons may not be able to afford medication, and so they would not be compliant for that reason, a lack of symptoms. This one is very common. A lot of people say that they have no symptoms, they're not feeling any way, doc, I'm not feeling anyhow, so I'm not going to take my medication because I'm feeling fine. When in reality, a lot of illnesses can be present and the person is completely asymptomatic. For example, hypertension is known as a silent killer and may only manifest itself in something severe such as a heart attack. Forgetfulness, and this is a genuine reason that can happen to anybody, especially if medication is newly prescribed, a person may forget to take. Mistrust, this can be because people don't trust their physician, or they don't trust the medication, or etc. So they may not want to comply with medication for this reason, and some people generally just don't like having to take a lot of medications, so they are not compliant. However, it is important to comply with medications as prescribed to prevent the worsening of your illness, which may lead to hospitalization and even death. The Center for Disease Control and Prevention estimates that non-adherence to medication and medical therapy causes 30 to 50% of chronic disease treatment failures and 125,000 deaths per year in the United States. And basically that means that 125 persons may not have died had they complied with their medical therapy and treatments. Now, why is follow-up important? So if an illness is detected, generally an individual would require follow-up to ensure that investigations done are reviewed and any necessary follow-up investigations are performed, prescriptions are refilled, and any relevant medical questions or concerns are answered. And so that is why it's important for individuals who are diagnosed with illnesses to keep their appointments, because it is an effective way to aid as well with prevention of worsening of disease. So in summary, cardiovascular disease continues to be the leading cause of death in Trinidad and Tobago. Persons diagnosed with these illnesses are at an increased risk of premature death. However, early detection and early intervention are the best ways to improve the prognosis of disease. So thank you very much, everyone, for listening. I do hope that you would have learned something. I hope that this information was beneficial to you. And stay tuned for the final installment of our RUCA SDA Health series on cardiovascular diseases.